Action.
Hi, Mrs. Potter. How are you today?
I'm good. How are you?
I'm good. My name is Sierra. I'm a student from the University of New England. Today I'm going to be performing a health assessment on you, so I'm going to be just doing your respiratory sounds and cardiac sounds on you and a couple other things. Is that all right with you?
Yeah, that's fine.
All right. Can you start with stating your name and date of birth for me?
Rachel Potter, 8/26/99.
All right. And do you know where you are right now?
I'm in my home.
And do you know what month it is?
It's October.
All right. So she's oriented to person, time, and place, and her behavior is appropriate and her speech is clear. I'm going to be starting with doing a neurological assessment on you. So I'm just going to be looking into your eyes with this pen light. So if you can just go ahead and look right here at my face. Okay. And then look at the end of this pen. And look with your eyes. Right. Her pupils are equal, round, and reactive to light and accommodation. I'm going to go ahead and look at your hands if that's all right with you. Be feeling for your pulses. Both are present, +2 regular. And can you squeeze my fingers? And push against my hands. And push against the other way. Perfect. And we're looking at her cap refill of both fingers. Less than 3 seconds. Less than 3 seconds. Normal. Next, I'm going to be listening to your heart sounds. I'm going to start with the diaphragm, so you can just relax for a minute. We'll be starting with the aortic, which is the second intercostal space, right sternal border. And we'll be going to the pulmonic, which is the second intercostal space, left sternal border. We're going to Erb's point, which is third intercostal space, left sternal border. Next, we'll be going to, sorry, we'll lift your shirt up. So we'll be going to tricuspid, which is the fifth intercostal space, left sternal border. And then last, we'll be going to apical, which is also known as mitral, which is in the fifth intercostal space, midclavicular on the left. S1 and S2 were noted, and there were no abnormal sounds, or S3 and S4 noted. I'm going to be going through these same points again with the bell of the stethoscope. Alright, and again, no abnormal sounds were noted. S1 and S2 were noted. Now I'm going to be doing a respiratory assessment on you, so I'm going to be listening to your lungs with my stethoscope. So if you can just sit up. I'm listening. Every time I touch my stethoscope to your chest, just take a deep breath in and out for me through your mouth.
Okay.
Alright, now I'm going to go around to your back. Doing the same thing again. I'm going to touch your stethoscope. Just take a deep breath in and out for me through your mouth. Perfect. Have you noticed any cough that you've had lately?
No cough.
Okay. And if she did have a cough, I would ask about her sputum, what color it is, and what consistency. And while back here, I'm going ahead and looking at her back. Have you had any pain or discomfort on your back recently?
No.
Ooh, it's cold. Sorry. And so you can go ahead and lay back down if you'd like, if that's uncomfortable. The rest of her skin, as noted, is pink, warm, and dry. Have you had any trouble with bruising lately? Any cuts or abnormalities on your skin?
Nope, nothing.
The skin seems normal. I'm gonna check your skin trigger. It's also normal. Alright, next I'm gonna be listening to your bowel sounds and feeling around a little bit. Have you had any trouble with your diet lately?
No.
Have you had any troubles going to the bathroom?
Nope, all good.
When was your last bowel movement?
This morning.
And how was it?
It was normal. Normal color.
Normal color, normal consistency?
Mm-hmm.
Alright, perfect. I'm gonna go ahead and be listening to your bowel sounds. I'm gonna be starting in the right lower quadrant. Normal bowel sounds were heard in all 4 quadrants. And now I'm going to be palpating, and if you have any pain or discomfort, let me know. And did you feel any pain or discomfort as I did that?
No.
I would also check for bowel distension. I would observe her bowels, or observe her stomach to look for any sort of raised. Have you had any problems with bloating or any
No.
in your stomach lately? Okay. And how has your peeing been lately?
It's good. Normal color.
Normal color. And how clear is it? Would you say
It's clear.
cloudy?
No.
Okay. And if she had any, or do you have any trouble getting to the bathroom all the time?
No.
Alright, if she had any problems with that, I would feel her bladder and check for any distension, or I would do a bladder scan. Now I'm going down to check your feet. I would check for any signs of edema or swelling, but none is present. I'm going to take your socks off real quick. Pedal pulses. Both are equal +2. Compare posterior tibial. Both are equal +2. Check her cap refill. Less than 3 seconds. Less than 3 seconds. Can you push in my hands? Can you pull the other way? Okay, perfect. So that's my assessment for today. If you need anything else, please let me know. This is your call light that you can ring.
Okay.
I'm going to be raising your side rail and lowering your bed to the lowest position.
Mm-hmm.
Is there anything else I can get for you?
No, I'm all set.
Okay, perfect. Have a good day.
All right. Thanks, you too.